Hi, this is Dr. Dennis Nikitow. Thanks for joining us today on the Chiropractic Approach to series. Now, who I have here is a wonderful man. His name is Buddy. His wife, his name is Joan. Joan's a retired registered nurse. And I want to talk to you a little bit about Buddy and his case. I want Buddy to explain a little bit about his case with you. And you saw Buddy walk in at the beginning here of the video just a second ago. Well, when Buddy came in to see me, Buddy couldn't walk. Okay, Buddy couldn't get up or move out of a wheelchair without passing out. And I remember his son Jeff came in to me and said, you know, my dad is literally dying. And he's been all over. He's been to Mayo Clinic, to Cleveland Clinic. He's been to all these different places, and nobody knows what's wrong with him. His blood pressure was down to, what, like 70/30, something in that range?
Sometimes we couldn't even get a reading.
Sometimes they couldn't even get a reading. So I want to explain to you, they diagnosed him with what's called orthostatic hypotension, which means that it's if you ever have bent over and you stand up quickly and get lightheaded, it's a functional distortion of the adrenal gland. Now I'm going to tell you why that happens, and also what we did to help him through chiropractic care. So Buddy, what I'd like you to do is just tell everybody from your own words kind of what kind of happened with you, and how did this thing start, how long was it going on, how severe was it? Just kind of, you know, tell everybody out there.
September 2011, wife and I were walking in the park on a daily walk, and I felt lightheaded and had to sit down. My dizziness left, and I stood back up, and it seemed to be all right. So I went to a family doctor, and he automatically thought it was something to do with my heart because I had two brothers that had open heart surgery. They sent me over to the hospital, and they ran tests for the heart, and it was all right. So that was basically it. He couldn't do anything. He didn't know what the problem was. And after putting up with this for a few months, I told the wife, I said, let's go to Mayo Clinic. Supposedly one of the best ones. Went down to Mayo Clinic, and the doctor there diagnosed what Dr. Nikitow told you I had. And they said there wasn't anything they could do for me other than put me on some medication.
They said it was the veins in his legs that weren't functioning right. That's why he was getting dizzy and his blood pressure was dropping.
Okay, I'll tell you why that happens in a moment. Continue.
And so they sent me on the way, went back home, and a few months later I said, well, let's go to Cleveland Clinic. So I went to Cleveland Clinic, and they said it was in my brain, all the problems. Well, I wasn't ready to have brain surgery, so I went back home, and we talked it over, and we figured we lived in Nevada at the time, figured it'd be better off if we got back around the Denver area where we had grandchildren and children to be around. So we did, we sold our home, went out to Denver, and my son Jeff was talking to me about Dr. Nikitow. He said, would you mind go seeing him? I said, I'll go see anybody if they can help me. So my first visit to Dr. Nikitow, they had to help me stand up to take x-rays. I couldn't stand up on my own, couldn't walk in there on my own to the x-ray room, I had to be wheeled in a wheelchair. And after the x-rays, I told Dr. Nikitow, if you can help me 10%, I'll be more than happy. Well, he surpassed that, and we're not done yet. Right now, I can walk 1/10 of a mile without getting dizzy. I get weak because I hadn't walked for so long, with no dizziness.
So you haven't been dizzy for a while.
None.
And it was like within the first few weeks,
Yep.
he already started improving. Okay, and I'm going to tell you a little bit about how and why that occurs. But in terms of, and Joan, you might want to jump in here, in terms of how Buddy was spiraling downhill, what did you really think was going to happen here?
I thought he was going to die.
Yeah.
I really thought he was going to die.
Yeah.
His color, he looked like a patient that had terminal cancer that was ready to go.
Yeah.
You know, and he just scared the heck out of me. I just was really, really worried.
Yeah.
And we figured we better move here where we're around kids because, you know, we had nobody in Nevada and nobody could seem to help him. So
Yeah. I remember when he came in, because Jeff told me, he said, now be careful with my dad because if he can't move out of the wheelchair, if he moves too fast, he just passes right out. I mean, that's a heck of a way to live. And I'll tell you what, folks, if you have anybody that has situations like this, you know, chiropractic could be a lot of benefit to them. Now, this isn't the silver bullet, the cure-all, but if they had what Buddy had, which we identified as spinal subluxation, his spine, as we looked at his spine, was twisted. If we look from the back, it should be straight, and Buddy's spine was literally twisted like this. Now, in this area are the nerves that go to the adrenal gland. Okay, the adrenal gland is a specific gland that controls the cortisone levels, the cortisol levels. It affects blood sugar, but it also secretes mineralocorticoid hormones that constrict blood vessels. So, in essence, it controls your your sodium and potassium levels. Now, they had you eating more salt, right?
Right.
Yeah.
Right.
Enough of that.
Okay, now here's what happened.
Caffeine.
And caffeine, because caffeine will constrict the blood, it'll fire up the adrenal to constrict blood vessels. Now, when people are under a lot of stress, when people eat the wrong foods like too many sugars, different things like that, and or what people don't realize, if the spine is out of alignment, you're blocking nerves that are going to affect the function of the body. The way chiropractic works, it's not a back pain treatment. We are nerve doctors working on pressure on the nervous system as a result of spinal misalignment, which is different than what a neurologist would do. We're looking for misalignment of the spine that would affect nerves. And what happens is when your spine's out of alignment, you don't feel pain right away. You can have dysfunction. You can have problems with vision. You can have problems with thinking. You can have problems with digestion. In Buddy's case, he had problems with the adrenal gland. So the adrenal was starting to shut down. It wasn't pumping the adrenaline properly the way it should. So therefore, the bronchial tubes won't dilate properly. They'll constrict. People can get asthma, trouble breathing. But in his case, he wasn't able to get the blood constricted, okay, because the adrenal wasn't working. It wasn't secreting the hormone to constrict the blood vessel and regulate the sodium and potassium, so the blood will get up to the brain. And in mild cases, early signs of adrenal fatigue is when you bend over and stand up quickly, you get lightheaded, bright lights bother your eyes, okay, because it keeps the pupils too dilated, okay. You can have tiredness or fatigue 2 to 4 in the afternoon. You can wake up 3 to 4 in the morning, just pop up, you don't sleep good. So those are some simple types of things. But anyway, to make a long story short, in Buddy's case, what we did is we identified the subluxations. We saw his spine crooked. I started adjusting him, and I'll show you the adjustments I was doing on him. And very simple things, but you need to go to a chiropractor who does what's called spinal correction, not chiropractors who just do symptom treatment, okay? Because you have to get x-rays, you have to identify where the actual pattern of the spine is. Three-dimensionally, we work with an XYZ axis, it's called Cartesian coordinates. When we identified his pattern, we reversed the pattern, started freeing up the nerve. The other thing we noticed with him is that his head, instead of from the side being in this position where the spine should have 3 curves or arcs, his neck had severe forward head posture. In fact, it was so severe that he was like looking down, so when he tried to look straight ahead, he was compressing on what we call the brainstem, which can cause a lot of vertigo and dizziness just by itself. So as we started to work his neck back, okay, you can see in the before and after x-rays of him, he made tremendous progress just within, what, 6 to 8 weeks? I ran the first x-ray?
We started here in May.
Yeah. What did you think of his first x-ray after 6 weeks?
I thought there was no way you could ever fix him.
What did you see on the x-ray?
I saw a lot of improvement,
Yeah.
and we thank God for you.
Yeah, well, thank you. I appreciate it. And then you started coming in, which we'll talk to them a little bit about your case, because Joan, being a retired registered nurse for how many years?
Oh, I was a nurse for 35 years.
Yeah, and she was on some pretty heavy drugs for that, but we'll kind of talk to you about that. Right now, what I want to do is I want to show you the simple adjustments that I did with Buddy and how effective this could be. So if any of you are out there that have these types of issues, I really want you to consider going to a chiropractor, because if they're doing corrective care, they can oftentimes help with these specific situations. Okay, so let me kind of show you what we do with Buddy with his adjustment, how I helped him with those specific things. Okay, Buddy, why don't you come on, stand up, and then turn, go ahead and climb up on the table and lay face down. Now look at this guy moving. I mean, this guy runs in and out of the clinic, okay? And it's pretty amazing because, again, we had to literally carry him up and down on a table, and he would be like half passing out all the time. Now, what we're going to do with Buddy now, as we noticed, first of all, let me show you on the spine. Okay, so this is Buddy facing me. This is the back of his spine, okay? So basically, when he came in, what I saw is his head was like way off to the side like this, okay? That's called a translation. So his head was pushed off to the right shoulder like this, okay, quite a bit. So that was distorting the brainstem. Secondly, he had a ton of forward head posture like this, okay? So his head, the spine's facing this direction. His head was actually falling off of him like this, so he was over-rounding his back here. As he over-rounds his back, that's called kyphosis. The next thing we noticed is that his spine was twisted way off to the side like this. So this is what this gentleman looked like, okay? So the adjustment that I did was, first of all, if you can see the roundness of his back here, I lift up this cushion, okay, and that flattens his lower back. Now, what we're doing here to fix his translation, his head over to the right shoulder, is we're going to move his torso over, put his head the opposite direction. When a patient's posture and spine is off, they begin to develop what's called nerve muscle memory. Okay, nerve muscle memory is there all the time, but when it starts to overfire to one side, the body tends to go back to that position. Now understand something, chiropractors do not put you in alignment. There's no such thing as it's in and it's out. So if chiropractors are telling you things like it's in, it's out, there's no such thing, because a chiropractor would have to take an x-ray before and after the adjustment to show you that the spinal positions have been put in alignment. The real way it works is that when a patient has postural distortions, which Buddy had for a number of years, eventually they start to close down on the nerve and affect function of the body. But the body develops what's called a nerve muscle memory. It's just like when we play sports, we do them over and over and over again. That practice helps us develop memory through the neuromuscular connections. But in posturing, if a person's posture is gradually going like this, eventually the nerve is firing harder on one side and not on the other side. Okay, so we get thrown out of balance because the nerve is what tells the muscle to pull. The muscle pulls the spine. Okay, so when chiropractors make adjustments, what they're doing actually is triggering the nerve and the receptors in the body. These balancing receptors called proprioceptors. We're triggering those with a high velocity to fire to tell the nerve how to fire to the muscle that then pulls it over. So when I adjust Buddy and I adjust him in this direction, I'm signaling these nerves to gradually pull him back into alignment. So that's the process that we do. The reason people go frequently to chiropractors is because we have to do repetitions, just like going to a gym and working out with weights or doing anything like that, or practicing sports, or practicing piano, or something like that. You do it repetitively, so now the posture begins to change. Now Buddy, on the other hand, would do certain exercises, like pushing his head over to the one side. We call those chirometrics exercises. They're isometric exercises based on the chiropractic pattern that we need to move the spine into. And we use this three-dimensional Cartesian coordinate axis system to actually identify things in 3 dimensions. Not all chiropractors use that, but it's something that you need to ask the chiropractor you're going to, do they do this type of work? They can watch this video, learn some of the things that we teach in our seminars and so on to help patients like this, okay? So let me show you what we basically did with Buddy. Once again, his head was going too far to the right, so I'm going to have him move his torso to the right. So scoot over to the right there, Buddy, way, way over, scoot over, keep going. All right, put your head into the center. So now what I would do is I would come over here and I make an adjustment on his neck and upper back in this direction. Okay, and then over here. Good. Now move back to the center. Now we got this section up to flatten down the center. I'd go right down to where the adrenal gland was and I'd make the adjustment. Let your breath out. Good. Once again. Awesome. Okay, good. Now we look at the pelvis and the hips. I'm looking at his leg length. He runs a little long on this side, which means his pelvis is pushed forward. So I'm going to have you lay on your side. And we're going to adjust your hip. Bend this over here. I'm going to adjust his pelvis. Good. Now, this is very important. I lift up his hip. Now remember, I said his back was very crooked. Okay, so I'm lifting up his hip here, okay, to drop down on his spine here. Okay, so basically, as I'm dropping down on this side, okay, it's helping to take the curve out of the back. Okay, now lay on your back. Okay, good. And again, his spine was curving, okay, off to the left. Remember, he's facing me. This would be the left side. This would be the right side. So what I'm doing here is laying him on his side, okay, and I'm lifting up the table on this section to come up, and I'm driving this portion of the spine downward. So that would center his spine. And done repetitively, you're triggering the muscles to tell the spine to move over into the center. That's why when you see his x-rays, within only 6 to 8 weeks, he made dramatic improvement, and now he's walking, like he said, 1/10 of a mile. He was walking probably after the first month, at least coming out of the wheelchair, walking a little bit. Now, we're now working on rehab to strengthen muscles, to get him nutrient and all these other things. We also gave supplementation that would help his adrenal gland get stronger, eating salt, drinking caffeine is very helpful for people who have that type of low blood pressure situation. Now his blood pressure is running relatively normal. The next thing I did up here was I adjusted up in his neck. Have a seat up. And then we would do some adjustment in the center to help the bowing of his back. Since his back is bowed, I'm going to do an adjustment here where I put my hand on the center portion of his spine, lean him back and do a little thrust, breathe out. Perfect. You love that one, don't you?
Yeah.
Okay, sit up straight. Now I'm going to lay his head back and lift the cushion, lay back. Now what we're doing is apexing the center of his back. I'm going to drop this down a little bit and I'm going to move his head backward. This is called a forward head posture adjustment. So we're going to cock the table, do a couple adjustments in this direction, and then have a seat up. So all in all, based on those simple adjustments, but being specific with spinal correction, what's really important is that if you get with a chiropractor, if you have any kind of issues like that, get with a chiropractor in the area that does spinal correction technique. They need to take x-rays so they show you before and after changes so you can actually see the change in the spine, okay? If a chiropractor isn't taking the x-rays to see inside, it's very difficult to actually identify the exact patterns. Also asked to see if they do a three-dimensional type of system, the X, Y, and Z axis, or what's called the Cartesian coordinate axis system, which is going to help tremendously with you being able to identify the problem and the chiropractor being able to help you with it. So I want to thank you, buddy, for coming in.
Thank you.
And I want to thank you for watching. If you have any other types of issues, go to our Chiropractic Approach To series or dial up my name, Dennis Nikitow, Nikitow. It's Dr. Dennis Nikitow. And there's a bunch of different YouTubes on different things that we're out there to try to help you see what the chiropractic approach to would be to help your specific problems. Thanks again, and we'll see you next time. Come on, buddy, let's get out the door.
Get out the
Go
door.
ahead, get out of here. There he goes, see you later. Okay,
Go away.
come on, look at this guy. Get over here. Get over here and give me a hug.
Thank you, Dr. McCall.
Okay.
Thanks a lot. I really
Okay.
appreciate it.
You're welcome. I know you do. All right, you guys, you have a good afternoon, okay?
Well, you have happy holidays, and we'll see you on Tuesday.
Sounds good. Bye-bye.
Okay, bye.